Thank you for joining us today for the Inpatient Rehabilitation Facility Quality Reporting Program Provider Training webinar, covering the IRF QRP, Achieving a Full Annual Increase Factor. My name is Rachel Boglai, and I will be your host and moderator today. Our agenda today includes the Inpatient Rehabilitation Quality Reporting Program, Inpatient Rehabilitation Facility Patient Assessment Instrument Submission and Reporting Requirements, Internet Quality Improvement and Evaluation System Report, determining compliance with the IRF QRP, and we will finish today's webinar with a list of resources as well as a question and answer session. At the conclusion of this program, we would like training participants to be able to, 1, recall the basics for the IRF QRP, 2, identify the IRF submission requirements and data submission threshold, 3, describe the steps related to IRF data submission and acceptance in IKeys, 4, discuss the application of various IKeys reports, 5, describe the impact of IRF QRP data submission on the annual increase factor, and 6, identify one resource for providers related to each of the topics presented. Now, I would like to introduce today's speakers. Ms. Ariel Adams is the IRF Quality Reporting Program Coordinator at CMS. She is a board-certified adult gerontology clinical nurse specialist with a background in quality and patient safety. Ms. Adams previously worked as a CNS within the MedStar Health System. Ms. Therese Rodda is an associate in U.S. Health Policy with ACT Associates. Ms. Rodda previously worked as a physical therapist across post-acute care settings. Slides 6, 7, and 8 in the slide deck contain a reference list of acronyms that will be used throughout today's presentation. Let's try out the polling function with our first question. The question is, how many people, including you, are joining this webinar together in the same room? A, just me, I am the only one participating. B, 2 people. C, 3 or 4 people. Or D, 5 or more people. So let's give everybody the opportunity to select their response. Okay, so let's broadcast the results, and it appears that the majority of people, 81%, are attending by themselves today. So let's try a second question. Which president signed Medicare into law? A, Richard M. Nixon, B, Lyndon B. Johnson, C, Dwight D. Eisenhower, or D, Gerald Ford? We'll give everybody the opportunity to select one of the response options. And it looks like the response options are stabilizing. So let's go ahead and broadcast the results. The correct answer is B, Lyndon B. Johnson. The majority of participants did get that one correct. So let's have our third and final practice question. Who was enrolled as the very first Medicare beneficiary by President Johnson? A, Harry S. Truman, B, Claudia Alta Lady Bird Johnson, C, Richard Nixon, or D, Betty Ford? We'll give it another minute for people to respond. Okay, so it looks like results have stabilized at this point. So We will broadcast results. So the correct answer is actually A, Harry S. Truman. As a reminder, we will conclude the event today with a final wrap-up and a Q&A session. If you have any questions throughout the presentation today, please submit them via the Q&A panel on the right side of your screen. It is now my pleasure to turn the session over to our presenters, Ms. Ariel Adams and Ms. Therese Rodda.
Thank you, and good afternoon, everyone. Okay, so for this first section, we are going to discuss the IRF QRP, review the CMS Quality Goals, and discuss IRF QRP requirements. IRF Quality Reporting Requirements are mandated by Section 3004 of the Patient Protection and Affordable Care Act. Reporting requirements for quality measures are published by October 1 of each year. The Impact Act of 2014 requires IRFs to submit standardized patient assessment data elements, including those associated with IRF quality measures, or QM. Freestanding IRFs, as well as units within acute care hospitals, long-term care hospitals, or critical access hospitals, are included in the IRF QRP. IRFs under the QRP may be subject to a reduction in their annual increase factor, or their AIF, also known as the annual payment update, or APU, of 2 percentage points if they do not submit required data. On the slide, we have listed the CMS quality goals. The delivery of quality health care is a high priority for CMS. CMS defines quality as being effective, efficient, equitable, patient-centered, safe, and timely. And as you can see on the slide, we have these goals listed out, and you can review those at your own pleasure. So the IRF QRP requirements. Data collection for IRF QRP is done using the IRF PI, or the IRF Patient Assessment Instrument, and also through the CDC Nhsn portal. Claims-based submissions do not require any additional data submissions. Data that is submitted for QM and SPADES must be submitted and accepted by CMS within the designated thresholds and by the established timelines. This graphic walks through an example of the process of the AIF cycle. Data submission occurs from January 1 to December 31 of a calendar year. Data is evaluated for compliance and a determination of that compliance is made. Non-compliance letters are sent out to providers who do not meet the data submission requirements around July. Upon receipt of this letter, IRFs have 30 days to submit a reconsideration request and provide documentation to dispute a determination made by CMS by a July-August timeframe. After a review of reconsideration, CMS will deliver the results of the review in September. If the IRF is still determined to be non-compliant, then October 1, the 2% reduction of the annual increase factor will go into effect. So in this next section, we will briefly review the IRF and discuss submission requirements and data submission deadlines, review data submission thresholds, as well as when and where to submit data and how to ensure data has been submitted and accepted into the IRF. The IRF is used to submit the patient assessment data that is collected within the IRF. It is required for the Medicare Part A and Medicare Part C patients discharged from an IRF. This data is used for QM calculation and in accordance with the QRP. IRFs are required to submit data no later than 11:59, the day of the quarterly submission deadline. Failure to meet this deadline will result in a 2% reduction in the annual increase factor. CDC data must be submitted to the Nhsn portal. This data is submitted on a monthly basis and is strongly recommended that healthcare facilities enter each month's data within 30 days of the end of the month in which it is collected. For example, all of March's data should be entered by April 30th so that it has the greatest impact on infection prevention activities. For the purposes of fulfilling CMS's quality measurement reporting requirements, each facility's data must be entered into Nhsn no later than 4.5 months after the end of the reporting quarter. So for instance, Q1, January, February, March data must be entered into the Nhsn by August 15th. Q2 must be entered by November 15th, Q3 by February 15th, and Q4 must be entered by May 15th. For the influenza coverage among healthcare personnel, Q4 and Q1 of current year's data must be entered by May 15th. Complete submission of all other Nhsn measures for all 12 months will be IRFs who complete the submission of all other Nhsn measure data for all 12 months will be found compliant. So to review, data submission runs from January to December. IRF data needs to be submitted and accepted into IRFs. And CDC data needs to be submitted into the Nhsn portal. And again, data must be submitted by 11:59 on the day of the final submission deadline. If the deadline date falls on a weekend, the submission deadline will be pushed to the next business day. Submission deadlines can be viewed in this table and are also on the Earthqrp website. In March of 2020, CMS provided temporary changes to the Earthqrp data submission requirements due to the COVID-19 public health emergency in order to assist IRFs while they directed resources towards caring for patients and ensuring the health and safety of patients and staff. CMS made reporting of QRP data for Q4 2019 optional and accepted QRP data for Q1 and Q2 of 2020. Data submission for Q4 of 2019 was strong, and these data will be included in measure calculations for public reporting. For Q1 and Q2 of 2020, any missing data that will impact what is displayed in the IRF will be looked at. Therefore, CMS developed a strategy to accommodate the accepted quarters of data. For more information for our public reporting strategy, I invite reviewers to review the FY22 IRF PPS proposed rule that is now published in the Federal Register. Because submission of the Earthqrp is a condition of payment, there was no change in the process for submitting data. But as noted before, for any missing or incomplete QRP data submitted during Q1 and Q2 of 2020, during Q1 and Q2 of 2020 will not negatively impact public reporting for IRFs. QRP requirements for submission did resume on July 1 of 2020. Okay, so let's review the data submission thresholds. So for a given data submission period, IRFs must submit 95% of the Earthqrp assessments that are 100% or fully complete. For CDC data, 100% of these data must be complete. IRFs that fail to meet data submission at the required thresholds will be subject to a 2% reduction in their annual increase factor. Earthqrp assessment data must be submitted for Medicare Part A and Part C patients. To meet QRP requirements, the Earthqrp submission requirements, deadline, and ensure data is accepted into IQEAS, and the act of submitting data does not equal the acceptance. So please ensure that the data is accepted. And this is just a reminder for admission assessments. All elements must be completed within the 3-day admission assessment period. This includes the day of admission and the 2 calendar days following ending at 11:59 p.m. And discharge assessment items should be completed within the 3 discharge assessment period days as well. This is the day of discharge and the 2 days prior. If a patient is discharged less than 3 calendar days, some discharge items may not be complete. Please review the IRF QRP manual to ensure you are coding the Earthqrp correctly and submitting all of the appropriate items. Okay, so Earthqrp quality indicators discharge assessment continues. A patient is discharged if the patient is formally released from the IRF or expires in the IRF. The admission assessment data must be transmitted at the same time the discharge data are transmitted. This is after the patient is discharged by the 7th calendar day in the period beginning with the last permitted discharge patient assessment instrument encoded by date. CMS will determine that the Earthqrp data was not transmitted late if it is transmitted no later than 27 calendar days from the day the patient is discharged. As we have discussed, Earthqrp data is submitted to CMS and to IQEAS. Please be sure that submissions are formatted correctly, the information is correct, and that your submission has been accepted by IQEAS. There is also an IQEAS reports and training guide that can serve as a reference for anyone who would like more information. IQs will confirm that your submission was received and includes the name and the file you submitted. This submission does not equal acceptance, but you can verify acceptance or rejection by viewing the Earthqrp final validation report. The final validation report is the only way to verify that your submission has been submitted. Okay, so let's go for a knowledge check. Where do you submit Earthqrp data for the IRF QRP? Is it A, the Nursing Home Survey Data Center, B, Centers for Disease Control and Prevention, the Quality Manager at your agency, or D, the IQs? Good. And it looks like we have a majority of people who have responded. Looks good, and we can see what the correct answer is. D, the IQs. Great. Okay, now I will turn it over to my colleague, Therese, who will present the next section of this presentation.
Thank you, Ariel. In this section, I will provide an overview of the IQs reports, specifically the final validation, review and correct, and provider threshold reports. I will discuss how each of these reports can be used to check compliance with the IRF QRP. I will be showing you screenshots from the IQs system throughout this part of the presentation, and it may be a little difficult without actually being in the application itself. But by providing the screenshots, I hope it will help you locate this information when you are actually in the application, especially if you have never accessed IQs reports. Also, please keep in mind the IQs system is updated periodically, and the current view may differ from the screenshots. Once you log into IQs with your user ID and password credentials, the Welcome to IQs page appears. From the Welcome to IQs page, you can select the Reports tab at the top of the page. A drop-down menu appears, and you can select the second option, Find a Report. And when you select Find a Report, a new web page appears with a list of available report categories and types. There are many valuable reports in the IQs system. The ones I will be discussing today are specific to the IRF setting. The third option in the Reports drop-down menu is My Reports. Choosing this option takes you to a web page providing you the opportunity to assess and manage your available reports. You can save your reports and organize them into folders for future use and reference. This graphic provides an overall review of quality reporting. As you can see, there are 3 reporting categories listed: IQs reporting, confidential reporting, and public reporting. The review and correct reports, provider threshold reports, and QM reports are all confidential reports that provide you with the ability to review and analyze underlying data to ensure that the data you have submitted was and is accurate. The provider preview report is also a confidential report, but this report provides a preview of the data that will be reported on Care Compare, which you see in the public reporting section of the overview. Today, I will be reviewing only those reports that will help support you in determining whether you are maintaining compliance with the IRF QRP requirements. The 3 reports I will be reviewing are the Final Validation Report, the Review and Correct Report, and the Provider Threshold Report. The Earthqrp Final Validation Report or FVR, is an automatically generated report in iKeys and is available within 24 hours of file submission. This report is placed in the provider's My Reports folder in iKeys. This report provides detailed information about the status of select submission files. It is critical for you to ensure that submitted records have been accepted. Submission alone does not mean that the records submitted were accepted. And of course, this is important when it comes to compliance with the IRF QRP requirements. If a record gets rejected, the facility must correct the errors identified in the FVR and resubmit. Failure to correct and resubmit those records may jeopardize compliance, not only with the IRF QRP, but with the IRF QMs. The FVR will indicate for you whether the records you submit for each file were accepted or rejected. It details the fatal file or record error or warning messages that the system encountered. While the FVR is auto-generated, it can also be user-requested. One reason for this is that the report is in the system for about 60 days. So if the report is removed from the system folder before you could print or save it, you can rerun the report. It's recommended that as a provider, you make it your habit to go in after each submission and go in the folder and look at your FVR for that submission. Making it part of your regular process ensures you are aware of the errors and warnings generated and provides you an opportunity to take action on that information. This is the screenshot view from iKeys of the Find a Report option under the Reports tab. Once in iKeys, again at least 24 hours after submission, you can request and retrieve your final validation report by selecting Provider Reports from the Report category drop-down menu, choosing the validation report from the Report Types drop-down, and selecting Find Report. This is what the FVR will look like once you access it. Again, I am providing these snapshots of reports so you can at least see what they look like. They'll obviously look different from the report you are accessing directly from the system. The top portion of the FVR contains the details of the file, such as the date and the time the file was submitted, the ID of the user who submitted the file, facility-specific information, and a summary of the submission statistics of the records in the zip file. Beneath this information about each IRF record processed by iKeys, including record and patient-specific information, as well as any error messages that were returned by the system for that IRF record. Let's talk a bit about the errors and warnings that you will see on the IRF FVR. As I've stated, these errors and warnings are intended to help you identify issues with the IRF submission and acceptance. Identifying and correcting issues related to the submission of records to iKeys helps you to maintain IRF QRP compliance. There are many conditions that may prevent a file or record from being successfully submitted, and the FVR will tell you whether or not the error is fatal, meaning that the record has not been accepted, or simply a warning, meaning that the record will be accepted, but the data submitted may have something awry. Maybe you'd like to ensure that it's accurate. Warnings affecting AIF occur when there is missing data. An example would be a discharge goal not entered for a GG item, or dashes on data elements used for measure calculation. Each error or warning has an identifier that you can cross-reference in Section 5 of the IRF Provider User's Guide. This section lists all of the errors and warnings and includes guidance for correcting errors if necessary. This guide is available on the QTSO website at the URL noted on the screen. And remember that all fatal errors in a file or record must be corrected and the file or record resubmitted. For fatal file errors, these are identified as submission file structure is checked against data submission specification. If the file doesn't meet the required specifications, the file can be rejected. Examples of a fatal file error could be that the file was submitted as a single record and not contained within a zip file, or there was something in the file that caused the system to be unable to read it. Remember that files that are rejected due to fatal errors must be corrected and resubmitted. What I just described was a fatal file rejection. However, the file can also be rejected if a record within the file contains a fatal error. Again, these errors are identified as each IRFQRP record within the submission file is checked for fatal errors against the data specification. Examples of fatal record errors might be an out-of-range response, such as when valid responses for an item are outside of the responses that the system is expecting. For instance, responses for an item are 1, 2, and 3, but the value submitted was 6. Another type of fatal record error might be an inconsistent relationship between items, such as an inconsistent date pattern, having the patient's birth date item in the same year as the admission date. Just like fatal file errors, fatal record errors cause a file to be rejected by IKeys, which means that the record was not accepted. Rejected records are not saved in IKeys. And again, a reminder that fatal records must be corrected and resubmitted in order to ensure data are accepted. You may also receive non-fatal errors or warnings. For example, when an IRFQRP record is submitted late, you will receive a non-fatal warning letting you know that the record was submitted late. Records that only contain warnings or non-fatal errors are accepted into IKeys, but it's still important to review these non-fatal errors to ensure that the data submitted is accurate. Anytime there is a fatal error, no matter whether there are non-fatal errors included, the record will be rejected and must be corrected. Remember, even if there is just a warning error, it doesn't mean that you shouldn't review them to see whether the information needs to be corrected and resubmitted. Here is an example of an error warning page in Section 5 of the IRFQRP Provider User's Guide. As you can see in this sample page, the error ID is listed, then the severity of the error. In the first case, you see a fatal error related to inconsistent response pattern, meaning that the provider entered a response into an item outside of the responses that the system expected. The description column gives you the cause and potential actions to rectify the issue. The second example shows the warning 5004, which is the warning for a data element that is associated with the AIF payment reduction due to the use of dash. Again, the error description column gives you the cause and potential actions to rectify the issue. Now, the review and correct reports are user-requested, on-demand reports, and are available and accessed in IKeys in a similar manner as the FVR, but by choosing the Quality Reporting Program from the Report category drop-down list and selecting the Review and Correct report from the Report Type drop-down list. These reports, as I stated when going through the overview, are confidential to providers. The information on the report provides both the quarterly and cumulative performance rates for the assessment-based publicly reported QMs at both the facility and the patient level. You are able to request data specific to a particular QM, and the data can be exported as a CSV flat file. It is important to understand that the QM information on these reports are not risk adjusted. These are only observed raw data. When you request the data, what we'll display are the 4 most recent quarters, as this information is provided in rolling quarters. And what that means is that once a new quarter of data is added, the oldest quarter of data is dropped. Review and Correct report does not provide the AIF status on its own, but it can be used in conjunction with other reports to help ensure data accuracy. It's a quick way to look at the raw data, check and see if a QM might be an issue, so that the provider can investigate and confirm the accuracy of the data they entered. Review and Correct is specifically given to facilities so that they can correct underlying data before any data gets publicly reported. As I stated, only the observed or raw data are provided. The risk-adjusted rates are not shown. These reports are available for providers to run with updated weekly data until the data correction deadline. So once that deadline has passed, that quarter's data is going to be rolled off and you will not be able to correct that data. But remember, each week the system will be updated with new data. So when that reporting quarter ends, data for the new reporting quarter will be available as early as the next day. That is, the QM data are refreshed weekly and on the first day of the quarter. This report also displays the data correction deadlines and whether the data correction period is open or closed. This is important to know because if you do find something on the Review and Correct report that leads you to believe underlying data are incorrect, meaning submitted data might have been erroneous, you will only be able to correct that underlying data when the submission deadline for that data is open. Once the data submission deadline has passed and the data submission period is closed, you cannot update the underlying data. As you may recall, due to the COVID-19 public health emergency exceptions, there will be no data available to correct. That is, you will see that for Q1 2020 and Q2 2020, the data correction period will be closed. Here are some of the sort fields for the patient-level data that are available in the Review and Correct reports. You can sort patient-level data by last name, first name, resident status, discharge date, and admission date. You can also sort by individual QM. Here's a table with a reminder of those IRF QRP data submission deadlines and correction periods I mentioned. The final submission deadlines for the IRF QRP are based on quarterly data collection timeframes, and all the IRF PI data must be finalized prior to the submission deadline. So looking at this table, you can see that, for example, data collected for Q1 in any particular calendar year is data that covers January 1 through March 31st. And the time frame from when you can review and correct the submitted data for that quarter is April 1 through August 15th. This same pattern holds true for the other 3 quarters of data. When a submission data deadline falls on a weekend or a major U.S. federal holiday, the system automatically accepts provider submissions up to midnight of the following business day. The data correction deadlines are for dates that are used to calculate the publicly reported measures and are not applied to the confidential QM reports. Remember that there will be no data available to correct. That is, the data correction period will not be open for Q1 and 2 of 2020 due to the COVID-19 public health emergency exceptions. Here is a snapshot of what a review and correct report looks like for facility-level data. As you can see, the report header consists of the report title and the number of pages, the facility ID, the CCN, name, city, and state, as well as the requested quarter, report release date, report run date, data calculation date, and report version number. Beneath that, you will see the QM displayed. Here it is showing the application of Falls QM. And then the table legend just above the data table. The table legend shows you what the following characters mean within the table. So if you see a dash, it means that the data is not available or applicable for that measure. An X if the measure was triggered, NT if the measure was not triggered, or an E if the measure was excluded from analysis based on QM exclusion criteria. And then there's the table headers, which include the reporting quarter, the CMS ID, start date, end date, data correction deadline, and then whether or not the data correction period is open or closed. In our example, we have 1 open quarter and 3 closed quarters, and the next column indicates the number of stays that triggered the measure. This is followed by a column with the number of IRF stays in the denominator, and then finally you see the facility percent for the QM for each of the quarters. Let's stop here for a second and think about what you do if a measure is triggered. Remember that the point of this report is to determine if any of the underlying data may need to be looked at. So for those reporting periods that are open, you could go back and look at which residents triggered the measure and double-check the data that was entered and submitted. You could also look at this and see that maybe there are only a few IRF stays and you know there were more than what's displayed. You also have the ability to review the resident level data by QM. So let's look at that patient level data table. Remember, we get this data by checking off that box on the report criteria selection screen that says we want to receive the QM information at the patient level. Here you can see that the headers for this report, for each reporting quarter selected, displays the patient's name, first and last, the patient ID, which is auto-generated by the system, the admission date, discharge date, data correction deadline for that particular quarter, whether the data correction period is open as of the run date of the report, the patient's status, and remember that you can filter this specific status information for whether the QM was triggered, not triggered, excluded, or whether data was not available or applicable or dashed when running the report. And finally, let's take a look at the IRF Provider Threshold Report, or PTR. This report is accessed from the Quality Reporting Program report category, just like the Review and Correct report, but by selecting Threshold Report from the Report Type drop-down list. The PTR provides details on the status of the measures required for the annual increase factor update by fiscal year. It, like the Review and Correct report, is user-requested on demand. The provider can specify the fiscal year of interest, and for that fiscal year, this report will display the number of successfully submitted patient assessments and the number of patient assessments submitted that were complete, as well as the percentage of those assessments that were submitted as complete and on time. The IRF PTR displays an asterisk for future monthly and quarterly dates when a measure is active, but the data are not yet available. Here is a snapshot of the PTR. The IRF QRP PTR details the following for the specified fiscal year: the number of IRF assessments submitted and submitted complete, as well as the percentage of IRF assessments submitted complete. So let's look at these in more detail. The number of IRF assessments submitted provides the total number of assessments submitted within the quarter and submitted to CMS by the data submission deadline for the data collection start and end date selected. This is the denominator. The next number is the number of IRF assessments submitted complete, which provides the total number of assessments identified in the denominator that do not contain dashes for any required data elements used to determine AIF compliance for the IRF QRP for the applicable fiscal year. This is the numerator. And finally, the percent of IRF assessments submitted complete provides the calculation result of the numerator, which again is the number of assessments submitted complete, divided by the denominator, which is the number of assessments submitted. IRFs with a percentage under 95% are determined to be non-compliant with the IRF QRP. Additional information about IKEY's reports can be found on the IKEY's YouTube site. The link here on the screen is very useful. There are useful resources also in the IRF QRP training page. All right, that was a lot of information presented on these IKEY's reports. So let's pause and check our knowledge. Here's the first question on the reports. Which report provides detailed information about the status of select submission files? Is it the IRF Final Validation Report, IRF Error Summary by Provider Report, the Review and Correct Report, or the Provider Threshold Report? Right, looks like our results are stabilizing. And we'll see, the answer is A, it's the IRF Final Validation Report. Let's try another one. Which of the following statements regarding the Review and Correct Report is false? It can be requested on demand, is confidential to providers, it provides only facility-level QM data, or it displays the 4 most recent quarters of data. Again, we're looking for which of the following statements is false. Like folks are still thinking. All right, and looks like the correct answer is C. That was false because it also provides patient-level QM data, not just facility. So now I'm going to explore the process for determining IRF QRP compliance. For the purposes of calculating compliance with the IRF QRP, IRF data submissions for the calendar year are reviewed against the requirements of the IRF QRP. IRF QRP requirements, as Ariel mentioned earlier, include submission and acceptance of IRF admission and/or discharge items during the reporting period. IRF data are required to be submitted by established quarterly deadlines, and 95% of the assessments received must contain 100% of the data required to calculate the IRF QRP QMs. And as I discussed earlier during our discussion of the Provider Threshold Report, The numerator contains the number of assessments completed with 100% of the required IRF data elements. The denominator contains the number of assessments submitted before the submission deadline. The result of the calculation yields the IRF threshold percentage. So here's an example. We had 100 assessments that were submitted on time. Of those, 95 contained 100% of the required data elements, resulting in a 95% threshold, which is compliant. Any IRF found non-compliant will receive a letter of notification from their Medicare Administrative Contractor, or MAC, which will include instructions for requesting reconsideration of this decision. In addition, all Medicare certified IRF compliance letters will be distributed electronically into the non-compliance notification folders within iKeys for each IRF to access. This letter also includes the reason or reasons for failing AIF compliance. News and updates may be found on the Keys Technical Support Office webpage. Only those providers considered non-compliant and subject to the reduction in the annual increase factor will get a letter. Compliant providers will not receive a letter. Now, let's get more specific about what is reconsideration. Reconsideration is a request for review of the initial CMS compliance determination for a given IRF for a given fiscal year. If an IRF has been identified for the 2 percentage point payment reduction in AIF, they have the right to request a reconsideration of the non-compliant decision. Why would an IRF submit a reconsideration request? Well, if they believe the CMS finding was an error, or if they have evidence of the impact of extraordinary circumstances which prevented timely submission of data. Requests for reconsideration must be submitted within 30 days after the date documented on the non-compliance notification letter. Requests will not be accepted after the 30-day deadline. When creating a reconsideration request, it is important to note that the reconsideration request must be submitted via email to CMS at the email address below and must contain a subject line name of IRF QRP reconsideration request and the IRF's CMS certification number, or CCN. Do not submit a reconsideration request to the MAC. Be sure to include the information below in the request: the CCN, the business name and address, the CEO or the designated contact information, the CMS identified reasons for noncompliance that you'll find in the notification letter, the reasons for requesting reconsideration, and any information supporting the IRF's belief that either the finding of noncompliance is an error or they have evidence of the impact of extraordinary circumstances which prevented timely data submission. It is important to be aware that determination will be made solely on the documentation that you provide. CMS will not contact the IRF to request additional information or to clarify incomplete or inconclusive information. Reconsideration requests that contain protected health information also will not be processed. After the reconsideration request is submitted, CMS should acknowledge receipt of the reconsideration request within 5 business days through an email. Following its review of the request and supporting documentation, reconsideration request decisions are distributed by the MAC and the reconsideration contractor in a trackable way. Could be FedEx, U.S. Post Office with tracking, If the decision upholds the finding of noncompliance, a provider may file an appeal with the Provider Reimbursement Review Board, or PRRB. Information about the PRRB and the appeal process can be found on the cms.gov PRRB review webpage. So here's a summary reminder of the reconsideration process do's and don'ts. You do want to send reports demonstrating compliance with all the PHI redacted. Do not submit PHI. Submit your reconsideration request prior to the deadline and ensure that you receive an email confirmation of receipt in addition to the automated response from the mailbox. Do not submit protected health information. Submit an email that is larger than 20 megabytes and submit reports from third-party vendors. A PHI tip: if submitting the FVR, check the update fields as these often contain protected patient health information. If any assessment was updated after the initial submission, those updates are listed on the FVR. Here is another reminder about the estimated reconsideration process timeline. Sometime in July, non-compliant IRFs that fail to meet the QRP requirements are notified. Sometime between July and August, reconsideration requests are due to CMS no later than 30 days from the date on the notification of non-compliance. CMS provides an email acknowledgement within 5 business days upon receipt of reconsideration request. In September, CMS notifies the IRFs of the decision on the reconsideration request. In October, the AIF penalty imposed on IRFs found to be non-compliant with the IRF QRP requirements. Some additional notes about the AIF. CMS annually updates the Medicare fee-for-service prospective payment rates provided to IRFs who are billing max for services provided to Medicare beneficiaries. This is called the IRF Annual Increase Factor, or AIF. The AIF occurs on a fiscal year basis every October 1st. IRFs that do not meet the reporting requirements of the IRF QRP are subject to a 2 percentage point reduction in their AIF. So now let's take a break and do some more questions. The first question is, which of the following statements regarding the reconsideration process is false? IRFs have 30 days to submit a reconsideration request. CMS contacts the IRF if it has further questions. Requests can only be sent by email, and CMS issues a reconsideration decision by regular mail and via iKeys. So which one is false? Okay, it looks like our answers are stabilizing here. The correct answer is D. CMS issues a reconsideration decision by regular mail and via iKeys. Reconsideration requests are actually distributed by the MAC and the reconsideration contractor in a trackable way. So let's review one more time the graphic presentation of the IRF QRP life cycle that we introduced at the beginning of the presentation. So I reviewed earlier that January through December the data are submitted. In July, providers are informed if they are non-compliant. Between July and August is the reconsideration time frame. Please note that it is only a 30-day reconsideration window. Sometime in late August, September, providers are informed of reconsideration results, and on October 1st, the AIF is implemented for that year. As I have gone through this presentation, I have mentioned resources and links along the way for you to access. And in this section, the links and resources have been compiled together for easy access. I would recommend you go to each link, review the information, and download and save any of the resources that you think would be helpful to you, or maybe even bookmark them in your internet browser so that you can access them easily. We have resources on the IRF QRP webpage where you can find the most current IRF manual and item sets, and the webpage that details the IRF reconsideration and extension process. And here are IKEY's resources discussed during today's training. We have reference manuals for IKEYs, reports training, error and warning information, and additional IKEYs training. And then finally, we have links to all the help desks that are available to you. They are specifically for the IRF QRP, including a general help desk, a public reporting help desk, reconsiderations and AIF compliance help desk. There are also help desks related to IKEY's system and the support website for IKEYs. As a program, the IRF QRP team has provided many in-person trainings, webinars, video vignettes, web-based trainings, and printable resources for IRFs. These trainings and resources can be found on the IRF QRP training webpage. So this concludes the presentation portion of the webinar. I'll turn the reins back over to our facilitator for today to queue up for the question and answer session. Rachel, take it away.
Thanks so much, Teresa. With the time remaining today, we'd like to answer some of the questions submitted through the Q&A panel. The first question we'd like to address is, can you provide more information on what data is required to be reported for the IRF QRP?
Yes, for information on the quality data IRF QRP, you can visit the IRF Quality Reporting Measures Information webpage on the IRF QRP website. And also, if you look into the download section at the bottom of the page, you can see the most recent AIF table for reporting requirements for our measures. And you should be able to view that document and get the information for the requirements for reporting for the IRF QRP.
Okay, thank you. The next question comes from a facility. Our facility did not receive a letter of non-compliance. Does that mean we are compliant with the IRF QRP?
So if you are getting, if you are not compliant, IRFs will be mailed a letter, or they can view it in the Casper system, and this should occur around June or July. If your IRF is compliant, you will not receive a letter. Also, checking the provider threshold reports regularly will provide details about compliance throughout the year, so you can use that as an additional resource to track your compliance throughout the year.
Awesome. Thanks, Ariel. The next one here, what percentage of IRF submissions are required this year to avoid the AIF reduction?
So IRFs must meet the two separate thresholds that we discussed in the presentation. There is the 95% threshold for the completion of the QM and SPADES data, and then there is the 100% threshold for measured data collected and submitted using the CDC Nhsn portal. If you fail to meet any of those submission requirements this year, your AIF will be reduced by 2 percentage points.
Okay, so the next question I have here, I don't understand why we're not compliant. The review and correct report shows that we are at 100%.
Okay, so the review and correct report provides data by measures and by quarter, both for facility and resident level of the provider's QM results for 4 rolling quarters and identifies the open and closed status of each quarter's data collection period as of the report run date. So of note, the QM calculations are performed weekly and on the first day of each quarter, so you can get a pretty accurate picture if you pull the report weekly or at a minimum monthly. Also remember that the review and correct report is not an AIF report. It was developed to allow providers to review their QM data to identify if any corrections or changes are necessary prior to the quarter's data submission deadline. It also gives the provider an opportunity to see their data calculated in a similar manner to the provider pre-review reports.
Okay, thank you. The next question I have here is on errors. How do I correct errors in my IRF assessment data?
Yes, that's a good question. Okay, so for more information about this, I would refer you to the Measures, Calculation, and Reporting User's Manual, which is located in the Download section on the IRF Quality Reporting Measures Information website. Please note, corrections to the IRF records must be submitted prior to the final submission deadline as outlined on the IRF Quality Reporting Data Submission Deadline website.
Okay, thank you. So the next question I have here is, how do I verify my Nhsn data for the IRF QRP?
Okay, so the best method to verify your current Nhsn data submission is by running the CMS data reports found in the analysis reporting section of Nhsn. Detailed guidance on how to run and interpret CMS reports and all other Nhsn reports, as well as any checklists used to ensure complete reporting can be found on the Nhsn website. And also, if you have any questions, please make sure you reach out to their help desk and they can provide some additional information for that.
Thank you so much. So with that, that is all we have time for today. So I'd like to thank our presenters for sharing their knowledge on today's webinar. This concludes the Inpatient Rehabilitation Facility Quality Reporting Program Provider Training webinar. The webinar slides presented today, which will include the answers to the polling questions as well as a recording of this webinar, will be posted to the IRF QRP website. Once this is posted, we will send you an email notifying you where to download the material. Thank you so much for attending, and please enjoy the rest of your day.